Losing weight isn't a one-size-fits-all endeavor. Each weight loss program comes with unique characteristics that might not be right for everyone. Joining us with what we should be asking before we sign on is Dr. Lucinda DeMarco, Chief Medical Officer for United Healthcare of South Carolina. It's great to see you again.
It's good to see you too as well, Layla. Thank you.
Yeah, so the old standbys, Jenny Craig, Weight Watchers, Nutrisystem, tried and true. There's some new ones as well, one of them called Noom. I've been seeing advertisements for those, but what would you say is the best way someone should approach a weight loss program if they feel that's best for them?
I think really when you look at weight loss programs, the first concept that needs to go right out of your mind is that if it's quick, it's probably not going to work well. You know, I also think that you need to consult with your physician and ask them what their recommendations are. You know, as far as weight loss goes, the bottom line is there's not a quick and easy fix, I wish. But it's looking at the amount of food, calories that you consume, and the amount of calories that you burn off. Mm-hmm. So if you consume less than you burn, you're going to lose weight. And so what a lot of those programs do is they just make things a little more rote so that you have direction of where to go, what to eat, that sort of thing. And it helps you track what you're eating. And then it also encourages you to exercise. And so doing those things in the right proportions, and most importantly, be accountable to someone or something, really ultimately is what's going to make you successful.
What about for those who aren't crazy about counting calories, who are also maybe self-starters, that they can police themselves? What recommendations do you have for folks like that?
Well, there's all kinds of apps these days, thank the Lord. You know, even if you have an iPhone, I think there's one that's called like My Health or something. You can really track your steps, you can track what you're eating, you know, and it'll help you with what you're taking in calorically. And also you can look at what you're burning calorie wise. And so, you know, for those that want to do it themselves, those are good ways. And there are even apps that will help support you, you know, with mindfulness and exercises and those kinds of things, so that you can be accountable to yourself, not necessarily somebody else. Right. And most of the apps are free. So you're not spending money to be accountable.
This is true. Now, when you say talk to your doctor, so for people who maybe are suffering from diabetes or high blood pressure or things like that, know thyself. It's best to start from a place where you know not only your personal habits, but also your health. So what are some of the other things that you should be asking your doctor before you engage in one of these programs?
Well, you know, all of those diagnoses that you just mentioned actually are terribly affected by what your weight is. And they are also affected, i.e. improved, on what your weight loss is. So it's really key to discuss that with your physician and stay in touch with your physician, because as you lose weight, medications may need to be adjusted. You know, for an example, you may need less diabetes medicine or less high blood pressure medicine, because you don't want to get into trouble with having like low sugars or feeling lightheaded because you've lost weight. Your body is doing much better because of that. And your medications have to be adjusted.
Most definitely, most definitely. And then besides the programs, there's all different kinds of diets out there. The Mediterranean diet, plant-based diet, keto, paleo. I mean, the list goes on and on. So it's a fun self-exploration and then just finding something that works for you. Dr. Lucinda DeMarco, thank you so much for joining us today.
Thank you, Layla. I appreciate it.
We're back after this. Stay safe. Thanks.